Hi, my name is Jennifer Donnelly, and my brief review was comparing the efficacy of and preference for the reinforcement-based interventions of non-contingent reinforcement, or NCR, and differential reinforcement of other behavior, or DRO. I chose to review reinforcement procedures because they're very common. They're usually preferred over punishment procedures because they're more socially valid and they tend to be less restrictive, and they're still very highly effective at reducing problem behaviors while increasing compliance. Furthermore, the recent rise in positive behavior support has led to an increase in reinforcement-based procedures being used since they prohibit punishment from being used. And while there are a wide variety of reinforcement-based interventions, this review compares two commonly used procedures, NCR and DRO. Starting with NCR, this is the delivery of reinforcement after a fixed amount of time, regardless of whether target behavior occurred. Its purpose is eliminating the reinforcement contingency between the target behavior and its function by supplying ample opportunity to access the functional reinforcer without engaging in the behavior. Since reinforcement is delivered on a timed schedule, it is easy to implement and therefore likely for the caregiver to adhere to it. It has also been shown to be very effective at reducing problem behavior, reinforcing the absence of that behavior, and increasing compliance. However, it is not without deficiencies. NCR has been proven most effective when the scheduled delivery is very dense, meaning that reinforcers are being frequently delivered, which raises the issue of having to later thin the reinforcement schedule. Thinning reinforcement may produce extinction bursts, which can be anything from inconvenient to the caregiver to very dangerous for the client and others, such as in the case with severe SIV or aggression. Additionally, due to reinforcement being non-contingent on the target behavior, it may inadvertently be reinforced throughout the schedule. Some studies have found a few ways that may alleviate these concerns. As for thinning the schedules, one study said that by doing so gradually reduced the chance of extinction bursts from occurring and made them less severe. Additionally, another study showed that introducing a signal before delivering the reinforcement also prevented extinction bursts from occurring. Finally, you can base the schedule of reinforcement on current interresponse time of the target behavior in order to reduce the chance of accidentally reinforcing that target behavior. DRO as an intervention works differently than the NCR. DRO creates a new reinforcement contingency to replace the contingency maintaining the problem behavior. Reinforcement is delivered after a set time only if the target behavior had not occurred throughout that interval. DRO, like NCR, has been shown to reduce problem behavior while increasing compliance. DR schedules are also flexible. You can implement whole interval where behavior must be absent the entire interval to receive reinforcement, a DRO with tolerance, which is when a predetermined number of responses are permitted to occur and still receive reinforcement, and momentary DRO, which is when behavior must be absent at the time of observation to receive reinforcement. These schedules reduce reinforcement of the target behavior. There are potential issues with DRO schedules as well. Traditional DRO, or whole interval DRO, require a caregiver to continuously monitor the client to determine if reinforcement is deliverable. Momentary DRO can alleviate this concern, as can DRO with tolerance, but both of these methods may show to be less effective than whole interval DRO because if the contingency is learned, it will not produce an overall decrease in the target behavior. Also, like the NCR schedule, a denser schedule of reinforcement in DRO has been shown to be most effective, raising the concern of how to later thin the schedule. Studies have explored how to alleviate these concerns. Due to the flexibility of DRO schedules, they can be altered to suit the needs of the individual and the particular behavior being targeted. For example, covert behaviors may decrease more efficiently under a DRO with tolerance schedule over a whole interval DRO. Also, like with the NCR schedule, a slow, gradual thinning of the schedule helps prevent a burst in behaviors. After reviewing the effectiveness of each procedure individually, I looked at the social validity and acceptance of each procedure when compared. Lebrat et al. Viewed how teachers in a preschool ranked both procedures after implementation and noted that DRO was ranked slightly higher than the NCR. In a study by Gaber et al., DRA, DRO, and NCR procedures were compared, and the DRA was the highest preferred, followed by the DRO. However, they noted that the setting was contrived to be simplistic, allowing differential reinforcement to be easier than normal to implement, which may have affected the preference assessment. Finally, a study by Kodak et al. Determined that as long as a good functional analysis was used, caregivers showed no real preference to any one procedure. The prior 3 studies also reviewed the overall effectiveness of each procedure. Labrat et al. Noted that despite the teachers showing slight preference for DRO, the students clinically responded better to the NCR schedule. Gabor et al. Also noted discrepancies between which procedure was most preferred and which were most effective. There was a lot of variability among all 3 schedules. Finally, Kodak et al. Showed that both DRO and NCR were highly effective, but only after a comprehensive functional analysis was completed and used when identifying reinforcers. An additional study by Thompson et al. Compared NCR, DRO, and extinction as control procedures. They noted that the NCR control failed to produce a full reduction of responses to baseline levels. Furthermore, when the treatment was reinstated, responding was slow to recover. They speculated that this was due to the NCR phase continuing to reinforce some responding from the treatment phase, resulting in NCR being a poor control procedure. The DRO as a control produced a greater reduction in responding, but not enough to return to baseline levels. Like the NCR control phase, responding also had a slow recovery rate after treatment was reinstated following a DRO control. Since DRO creates a new contingency for reinforcement, this was suspected to interfere with the treatment contingency. In the end, Thompson et al. Determined extinction was more efficient than both the NCR and DRO procedures as a control. Upon reviewing the literature, the superiority of one procedure over the other remains indeterminable. Both non-contingent reinforcement and differential reinforcement of other behavior can work to be highly effective procedures for reducing problem behaviors and increasing compliance. While neither may be perfect for every scenario, utilizing a comprehensive functional analysis when using either NCR or DRO procedures does increase the effectiveness of each procedure. In the end, understanding each procedure's strengths and downfalls can help a clinician in deciding which procedure to implement.